Is it wrong to have a foot fetish? Hi, my name is Luke Vu, PhD, clinical psychologist, mental health expert, helping young men overcome digital addiction, depression, and anxiety. Today we're talking about foot fetishes and a little bit of the science behind them. Quick disclaimer, I'm not your psych, this isn't treatment, and if you need a psychologist, you should find a registered, qualified psych in your area. So what is a foot fetish and how common is it? So a foot fetish is genuinely defined as a sexual interest in feet, sometimes referred to as a foot kink. There are many ways that a foot fetish can form, and it varies from individual to individual. Foot fetishes can involve the physical side of feet, depictions of feet, non-sexual stimulation of feet, and sexual acts involving feet. For some, they consume foot-related pornography exclusively, while others may include foot-related pornography as a wider range of sexual interests. Some individuals will actively involve their sexual interest in feet with partnered sex. And sexual interest in feet can also extend to tickling or to objects such as shoes and stockings, or a preference of feet stimulation in a sexual context. Some people have very strong fetishes. That is, they cannot become aroused at all without the presence of the sexual object or body part, and that's the clinical definition of fetish. Others might only have a strong interest or passing interest in feet, sometimes referred to as kinks. Now, not all fetishes or kinks cause impairments to quality of life or cause distress, and not all will meet the diagnostic criteria for a clinical disorder. And in everyday language, kinks and fetishes are often used interchangeably. Foot fetishes aren't a modern phenomenon, and it's the most common body part fetish followed by body fluid fetishes. Now, sexual interest in feet has been observed in erotic poetry from ancient Greece to the 12th, 16th, and 19th century Europe, and it's speculated by researchers that an increase in foot-related depictions are because foot-related sexual activities can be a safe form of sex during STD pandemics. How do people develop fetishes? And why do people like feet? No one really knows exactly how fetishes are developed, but there is a neuroscientifically plausible mechanism that may suggest a reason for foot-related sexual interests. In general, the brain region associated with sensory processing is called the somatosensory homunculus. When we examine how input from body parts is processed by the brain, we can see that processing of sensations of the foot is adjacent to the processing of genitals. Now, this leads researchers to suggest that there's some possible cross-linking of these areas that may predispose some individuals to find stimulation of the feet to be similar in its potential to sexually arouse as genital stimulation. Now, this suggestion does have some critiques, from the oversimplified brain map itself to its inability to account for the great diversity of fetishes that we observe that don't have a clear neuroanatomical basis, such as BDSM or body fluid fetishes. However, it is plausible in explaining why it's more common. Now, in addition, psychologists in the 60s have also found that individuals can learn to sexually respond to feet or shoe-related materials. In an experiment showing pictures of naked women followed by images of boots and heels, men who had no sexual responses to feet prior to this conditioning did demonstrate a sexual response after conditioning, measured by volume changes to their penis. So what does this mean for the everyday person? Well, depending on how you interpret this, you can argue that for some, sexual interest in feet is intrinsic, and it doesn't need to have an underlying malicious or deviant component to it. And also, if you did not have an initial sexual interest in feet, you may have learned by experience that this is something that you found arousing. Now, for some, these sexual interests may be difficult to alter, change, or suppress, which may be a source of distress, especially if you feel ashamed or wrong about your sexual interests. It's important to note that it's okay to have diverse sexual interests, and that acceptance and a positive approach to sexual expression and preference is better for your mental health. And understanding that it's far more common and neurophysiologically understood might be a validating experience. Are fetishes normal? And why does the word have such a bad connotation? Fetishes are normal and commonly found in 10% of people, and in 1% it may impact an individual enough to be a clinical disorder. In the past, fetishes may have been met with judgment and shame because it represents deviancy from the normal. But as scientists better understand the diverse and fluid nature of sexual preferences and interests, that framework of conventional versus unconventional interests isn't a helpful way to categorize sexual interests. Rather than have this binary classification of normal versus abnormal, it's far more helpful to see this as individual differences in sexuality, sexual interests, and preferences. Now, should I be embarrassed or reject my fetish, or should I embrace it? Now, I think it's counterintuitive to reject or suppress a fetish because it may have the opposite effect of increasing your attention to it. You can learn to embrace and explore to see if it's helpful or self-destructive. And you can assess to see if this is something that is legal, safe, consensual, and an overall positive influence in your life. If you discover that it's harmful, unsafe, or illegal, then you can make the choice to disengage from that interest. If you decide to incorporate that interest in your life, ensure that it's in moderation and doesn't become an obsession. If my partner has brought up their foot fetish, how should I respond? Well, the key here is communication without judgment. Be attentive and listen to your partner. Understand the nuances of their interests and how it came to be. And evaluate if that's something that you're comfortable with, conceptually and practically. Evaluate if it's something you wish to collaboratively integrate into your personal life. It can be a bonding experience if you're both collaborative, and remember, you can always change your mind. If it isn't something that you're comfortable with, it is always 100% okay to express your boundaries, and you can both work out ways for your partner to express that interest in another way. What if I have a fetish I want to introduce to my partner? How should I bring it up? I think sometimes we get caught up in the idea of having our partner match that same level of enthusiasm about your fetish. And sometimes we overwhelm our partner and ourselves with expectations and judgment. So take a moment. If you haven't already, learn to have a dialogue about sex first. Understand each other's needs, wants, desires, and fantasies. And as you understand more about each other and feel safe to share your thoughts, you can start to share your interests in a mutually vulnerable way, as opposed to making a pressured request that can be perceived as an imposing demand. And by the way, you might discover that you have other joint interests as a couple that you might want to explore as well. So what are some steps I can take if I no longer want to be aroused by my fetish? Now, fetishes and sexual interests are often reinforced. That is, the more you consume or the more you incorporate that fetish, the more appealing and more desirable it becomes. Now, we can also use this principle in reverse. The less often you engage with your fetish, the less interesting and the less compelling it becomes. So one of the first steps is to understand any external factors that might be bringing that fetish into your day-to-day life and reducing those cues, triggers, and situations that are often associated with that fetish. This might be boredom, your digital consumption patterns, or stress. Accept that there's a range of interests that is worth exploring other than your fetish, and that it's helpful to increase the flexibility and diversity of your sexual interests. Allow yourself to explore other sexual avenues that you feel good about, or substituting with other non-sexual activities. Now, if your fetish has caused distress or negative consequences, there are some cognitive techniques to try to pair up and associate your urge towards your fetish with the memory of the negative consequences that it's cost you. And this will help you discourage yourself from engaging in that fetish. So I hope this provided some clinical context behind why people through history have fixated on feet and some tips on how to communicate your fetishes to your partner. So if you found this helpful, don't forget to hit subscribe. I'm Luke Vu. Be kind, be you. Catch you next time.